It's important to have this conversation early on in the person's dementia journey, where they have ability to comprehend what's been said and to understand what they're documenting. It's often tied in with when we discuss about getting their affairs in order, their enduring power of attorney and their finances through making a will. And it's a nice segue to get in there is that something like completing an advanced care plan is really important documentation because it advises both the family and health professionals what their wishes are for the future.
I can't remember what I did now. Yeah.
Yes, I can't really remember how much we got done on the course. It would have been quite incomplete, I think. And Colin then, on his own, did nearly all of this in pencil, and then we went through it together because there were some inconsistencies and errors. So went through really preserving the intent, but trying to make it less. We didn't want ambiguities in it. Friends, family, and the natural world. With friends and family, research particularly on plants. If my time were limited, my priorities would be completing a book about Nepal, spending more time with my closest friends. The first choice was I like to know. One extreme, only the basics, but Colin has ticked the other end, all the details about my condition and my treatment. And then as doctors treat me, I would like my doctors to do what they think best. Mm-hmm. And so you've ticked that end of the spectrum rather than wanting to have a say in every decision. If I had an illness that was going to shorten my life, I prefer to know my doctor's best estimate for how long I have to live. Mm-hmm. How involved do you want your loved ones to be? I want them to do exactly as I've said, even if it makes them uncomfortable. And when it comes to sharing information, I'm comfortable with my loved ones knowing everything about my health. It's helpful for family because we're not worried about what to do. We can the intent, Colin's intent here is very clear, I think. I do not want to be kept alive on any life support system.
Oh, so I used the same thing.
Such as in hospital.
Same as what Mum had.
Yeah, this is very similar, Colin. Yeah. I do not want any of my organs removed from my body and wish to be cremated. In particular, I do not want any religious service at all.
In order to complete the ACP, we advise that people, again, just take the time with it, but often it's described as having a conversation around the dining room table, talking about how you're feeling, and so you're sharing that with other members. In completing my own, I started writing that on my own and I found it quite difficult, quite emotive. My family live in the UK. So I got to a point where I couldn't proceed any further because I wanted to talk to them about it. So this is, again, it's that thinking what I would like, writing it down, and then sharing it with other people. So it just eases that time, that very emotional time for the individual when they're making decisions on behalf of somebody else, knowing that I had that conversation.